Okay, thank you, everybody. I'm talking about how the pieces of the puzzle fit together, so I hope you're enjoying this slideshow. Welcome to everybody viewing and to the media who are here covering the event today. Before we start, I'd like to share some news that took place in the House of Assembly last week, significant for physicians in the province. The Department of Digital Government Service NL had received correspondence from the NLMA about amendments to the Pension Benefits Act. So the amendments will provide physicians with the opportunity to join Medicus Pension Plan, a national multi-employer pension plan specifically designed for physicians. It will provide physicians with an opportunity to access a pooled pension arrangement where they can receive pension income during retirement. It is open to incorporated physicians in other provinces and territories, and it is the first and only plan of its kind designed exclusively for physicians. This is another retirement savings option for physicians in our province and will also be an incentive for the province that will assist in our ongoing efforts to recruit and retain physicians. So moving on to the news of today, our actions in recent months have focused on innovative ways to increase access to health care. For example, Heart Force One is flying people from rural regions to St. John's to get cardiac cath procedures and then flying them home to recover. Our traveling orthopedic teams are traveling to St. Anthony and Carbonear to perform surgeries before returning to St. John's. And we are looking to expand orthopedic procedures in the province. Same-day hip and knee replacement surgeries are sending people home to recover in the comfort of their home and allowing acute care beds to be used by somebody else. We have over 50,000 people now rostered to family care teams. These are resulting in improvements to the delivery of health care in the province. All of these result in people getting the care they need sooner, people getting the care they need more conveniently. Today, we are here to provide details on our newest action, which will result in improvements in access to healthcare services. People are getting the care they need sooner. This is an action today that we believe will have significant impact. We are excited to announce that a new virtual care program is launching this month. Newfoundland and Labrador Health Services has signed a 2-year contract with Teladoc Health Canada to provide virtual care in Newfoundland and Labrador. The approximate annual cost is $11 million. Teladoc Health Canada provides services in Canada and around the world, including partnering with public healthcare systems. Teladoc will now be offering technology and physician services in Newfoundland and Labrador. This service does not replace local doctors, including family doctors or physicians working in urgent care centers or emergency rooms. This virtual care service will complement existing services, improve access to the overall delivery of health care, add services to people where needed, where they are in need of a family physician. For emergency rooms or urgent care centers, this virtual care solution will keep facilities open and ensure patients have a place to go when needing care. Patients will be seen by a physician on the screen and will have a local healthcare professional with them to complete physical exams and triage. The virtual physician will work with the on-the-ground staff to deliver care as needed. For patients who do not have access to a family physician and are on the provincial wait list, like Patient Connect, the virtual care solution will provide access to a physician virtually. This will be delivered through an online application, web-based service, or phone. There will be both on-demand and appointment services. When the physician determines that a person will require follow-up services, they will work with Newfoundland and Labrador Health Services for in-person care. Our recruitment is working. We remain competitive in a global market. We have recruited over 70 physicians since the start of this fiscal year. We've recruited over 300 nurses. The first site for the new virtual emergency room will be the Kittiwake Health Centre in New West Valley. Currently, there are local physicians who are covering the site, and Teladoc will step in when needed. It will expand to other communities that need the service in the following weeks and months. In recent weeks, you may have heard of questions being asked about pay. It is important to note that the contract requires that Teladoc not recruit or engage physicians who are actively practicing in the province. It requires virtual physicians to be members of the College of Physicians and Surgeons of Newfoundland and Labrador, and also members of the NLMA. We will pay virtual care physicians at rates that are in line with pay that physicians are receiving in this province, in line with the MOA with the NLMA. This is a significant step forward for healthcare in our province. What this means is emergency departments can remain open. People will get the care they need at the closest emergency department or urgent care centre and not have to travel as far or to another community. Patients who are waiting for a family care team will have access to a physician virtually. If in-person care is required, it will be available. I'll now turn it over to Steve Green for further comments.
Thank you, Minister Osborne, and good morning, everyone. On behalf of Newfoundland and Labrador Health Services, I'm pleased to share the details of our new primary and emergency virtual care services. These services will add much-needed capacity to our health system and provide patients across our province with the increased access so they get the care they need when and where they need it most. I know this will be welcome news to many, and I will now review the details of the two new offerings and what patients can expect in the coming weeks. As Minister Osborne mentioned, virtual primary care will allow individuals who do not have a current family doctor or nurse practitioner, as well as their children, to attend video or phone appointments with a virtual primary care provider. This service will be offered by Teladoc Health Canada from 8 a.m. to 8 p.m. Newfoundland time, 7:30 to 7:30 in Labrador, Monday through Friday. To be eligible for the service, you will need to have a valid MCP number. You will need to be signed up on Patient Connect NL or be assigned by your health zone based on legacy existing wait lists. There's no need to re-register on Patient Connect NL if you've already done so. Your name is already on the list. For those who haven't registered, you can visit patientconnectnl.ca to register and be considered eligible for the virtual primary care services. We are taking a phased approach to ensure eligible Newfoundlanders and Labradorians receive access to this new virtual primary care service. Later this month, we will begin enrolling the first 15,000 people. The first group will be representative of our provincial population covering all health zones and will be selected based on the date registered on Patient Connect NL. Those eligible will receive a letter in the mail with information on how you and or your child can sign up and download the Teladoc app. Virtual primary care is a free service for the people of the province, and it is based on a secure and private digital platform. We are also announcing today a new virtual emergency room service, which will help emergency rooms in communities deliver accessible and convenient care in addition to virtual physician coverage for urgent care centers as needed. This service will help keep our ERs open and expand their operating hours so patients can receive the medical attention they need without having to travel outside the community. People may be wondering, how can emergencies be treated virtually? If your nearest emergency room is using this technology, you will see a clinician in person first and then be connected to a virtual ER doctor through a remote device. The virtual ER doctor and your on-site clinician will work together to conduct an assessment, determine a diagnosis, and a treatment plan. In the few cases where the healthcare facility is not equipped with the necessary technology, such as diagnostic equipment, or where a medical doctor is needed for in-person treatment, patients will be transferred to a full-service hospital exactly as they are today. In closing, thank you for being here today for this important announcement. At Newfoundland and Labrador Health Services, we are committed to increasing access and reshaping the healthcare system as envisioned by the Health Accord. This announcement today is just one example of the work we are doing towards accomplishing this goal. I encourage everyone to visit virtualcarenl.ca for more information on our new virtual care service. Thank you, and I will now turn it over to Dr. Pat Parfrey for additional comments.
Thanks very much, Steve. As you know, I'm here because my job is to influence the implementation of the actions recommended by the Health Accord. And one of the major actions that we recommended concerned strengthening community care, and particularly becomes more important as this is a major problem across the country with the deficit of family doctors and access to emergency rooms. And implicit in our recommendations was that family care teams should be instituted and that virtual care should be embraced, and that virtual care was going to be a major element of the healthcare system as we go forward. In fact, Newfoundland and Labrador has a history of being first in the country for virtual care, particularly through its telemedicine initiatives 20 or 30 years ago. So we strongly recommend embracing virtual care, and the two efforts here are, one is around providing emergency care through access from a provider with an emergency room direct to a doctor, and the second one is improving continuing primary care from a person needing it, communicating directly with a doctor. So I think these are good announcements in being able to improve community care in the province.
Thank you, Dr. Parfrey. We'll certainly welcome any questions from the media.
Minister, can you give some timelines, on where we are with the virtual ER and when you hope to, I know it's going to be in a few weeks, you're going to start soliciting or eliciting requests from people, but when do you hope people to be actually taking advantage of both this service that you're announcing today and the virtual ER? When will they actually be enacted?
So this month in November, we're literally talking days or a couple of weeks at the most. New West Valley is the first emergency department. We will be looking based on need. We have another emergency department in mind, but based on recruitment, the need may change. So we're not going to announce the second site today, because 6 or 8 weeks from now, when we look to put the second site in place, based on recruitment efforts, that site may be different than what we envision today. In terms of individuals who are registered with Patient Connect, this will be a gated, phased approach. And the reason for that, we've seen and learned from other jurisdictions that they opened it up too quickly, and the system had challenges. So we are phasing it in. So 15,000 people, anybody who's registered with Patient Connect will be contacted. The first group or cohort will be 15,000 individuals who will receive a letter advising how they register for a Teladoc app and receive virtual physician coverage. Once those letters go out, then the remainder of the individuals on Patient Connect will be advised that they are next in line, and will be phasing it in at 15,000 people at a time. And it'll, again, 4 to 6 weeks is what we hope will be the second grouping of 15,000 to be added, followed by the third grouping of 15,000. It's important, the difference in episodic care and the continuity of care is important, and that's one of the things that we've discussed with the NLMA. So this, we are starting to provide coverage to individuals who are not connected to a primary care provider, that are connected to Patient Connect or registered with Patient Connect and have a valid MCP. Those who are connected to a primary care provider, that continuity of care provided by your primary care provider is important. We recognize that, the NLMA recognizes that. So what's being provided here, you may have the same physician virtually, you may have a different physician. So it's more episodic, but episodic care is better than no care. So providing the virtual care through Teladoc for individuals who are not connected is what we're aiming to do for primary care, for emergency care. We will have the equivalent of 5 sites. That may be 6 or 8 or 10 sites based on physicians that are working on the ground and in-person emergency coverage or urgent care coverage. But it's the equivalent of 5 full-time sites in the province once this is fully rolled out, which should allow us, based on the health practitioners that are available on the ground, to provide the in-person triage and care, whether it be a nurse practitioner, a nurse, an advanced care paramedic, or a respiratory therapist, for example, will allow an emergency department to stay open with virtual physician coverage.
So just so I'm clear, virtual ER this month, virtual primary care to be determined, when it'll actually be physically in place.
So this month we will have the 15,000 letters mailed out, and as people register for the app, they will be able to access virtual primary coverage as well. So that will be, the letters will be mailed out this month. You'll see people in December starting to download the app and have access to virtual primary coverage as well. I believe that's correct, Steve?
That, that is correct.
So
Yep.
people could be actually utilizing this service, be approved, everything else in December?
Yes,
Okay.
correct.
And the ER, though, is this month, correct? To start?
Yes, that's correct.
The contract I know is for 2 years, but I'm curious, like, that could be extended. But I wanted to ask, do you see virtual care, either through Teladoc or some other virtual care provider, being a part of the long-term strategy of handling the family or the physician shortage in the province?
So we've been very successful in terms of recruiting physicians when you look at other jurisdictions. Obviously, we want to be more successful. It is a globally competitive environment in terms of physician recruitment. But the short answer to your question is yes. This is a 2-year contract valued at $11 million a year. It's renewable for a 3rd year, at which point I would say we will go to an RFP again for similar coverage. There will be communities in the province, because of an aging demographic, and some communities have a shrinking population, that simply will not be able to attract a physician. So I do see virtual primary care being a tool that will be used into the future. The continuity of care by a family care team is what we are aiming for every individual in the province, but virtual will have a role to play.
Right, and just, I guess, to follow up on that, Teladoc is a private company, so can you speak to the fears that people have about our healthcare system becoming privatized?
Well, absolutely not. It won't be privatized. When you go to your doctor's office, that's a private company, but they're paid publicly. they're part of the public system. When you go to your dentist office, it's a private company, but if the coverage is for those up to 18 years of age, MCP covers your coverage, so it's publicly funded. These doctors will be registered with the NLMA or attached to the NLMA, will be licensed by the College of Physicians and Surgeons, and they're paid with public dollars to provide coverage in the province, no different than a doctor's office in terms of their connection to the public system.
So the contract, I believe, stipulates that Teladoc can't recruit doctors from a community-based practice here, but what's to prevent a physician from choosing to work for them?
Well, I mean, a physician can choose to work in a private doctor's office. A physician can choose to move to another province. We can't dictate where a physician may want to work. So the contract does say that, and states protects. One of the concerns that we wanted to ensure was addressed in consultation with the NLMA several months ago, a concern that they raised. So Teladoc cannot actively recruit physicians in this province. If a physician is retired, they may want to contribute and provide 8 or 10 or 20 hours a week. They can work from their own home, so this maybe is a call to retired physicians that if you do want to contribute, this is a way that you can do that. So a retired physician can, or if we have a salaried physician working with the health authority who want to put in some hours on the weekends or after hours, once they've fulfilled their obligation to the health authority, can provide hours through Teladoc as well. But the contract explicitly states that they cannot poach doctors who are actively working and performing services in the province.
And my understanding is that physicians working for Teladoc will be paid by Teladoc, and they'll be paid similar amounts as they would be if they were paid by MCP directly. And of course the company Teladoc is going to expect to make some money as well. So it seems to me, is it fair to say that this is going to cost more than if we had family care available for everyone in the province?
The value of this it is probably priceless, really. If you are living in a rural community with no family doctor, this is now the provincial government and the provincial health authority providing another tool, another avenue to primary care for those who don't have it. And I would argue that providing this service is worth every dollar that the contract is, because we are providing primary care, access to primary care for those who don't have it.
And I'm certain people receiving care would agree with you, but are we paying a premium in the same way we pay more for travel nurses? Like, are we paying more for this care than if we had simply paid for primary care doctors to do it?
So we have other provinces that are utilizing the services of Teladoc. There are other jurisdictions globally. This is something that has been tried and tested and proven in other jurisdictions. You won't get any argument from me on the value of providing primary care to those that don't have it. So, I will say that having an avenue to primary care, having access to primary care for those that don't have it, we are also the most attractive province in Canada in terms of incentives paid to attract, recruit, and retain physicians. So we are providing large incentives to recruit physicians here. I believe that this contract is certainly worth it.
Can I just add? I think that we have to embrace virtual care. It's the future, and that there are engagements with physicians that do not necessarily have to be face to face, and sometimes they're impossible face to face for isolation reasons. And I think that COVID demonstrated that it's feasible to do virtual care reasonably well. And I think that we'll have to extend it to tertiary care. So I think we will be embracing, in the medicine of the future, we will be embracing virtual care.
Is
You
it
mentioned
we're doing that because we don't have a choice, though? If we had a choice?
No, it is a better way of delivering care. It certainly, we're not talking about 100% virtual care, for sure that's not the case. But there is a role for virtual care in how we deliver services.
You mentioned utilizing the phased-in approach because of what you saw in other provinces. Are there any other issues that other jurisdictions ran into that you're hoping that you've learned from that in implementing this?
I'll ask Steve to respond to this perhaps in more detail. He's ultimately familiar with the contract. But we have looked at what has worked and the challenges in other jurisdictions. That doesn't mean that, we may not see a speed bump somewhere in the road in this. We'll deal with it if we do. But looking at a phased-in approach will address some of the concerns that we're seeing in other jurisdictions. And on that, I will put out there to individuals who are registered with Patient Connect that this phased-in approach will mean that they will get access to primary care sooner than if we did not do it. But we will ask that those who are registered with Patient Connect to be patient with the fact that we're rolling it out to 15,000 people who have been registered the longest with Patient Connect based on geography in the province, so that we have we're providing access equally across the province based on the length of time people have waited. But we've got about 50,000 people registered on Patient Connect. So there may be others who do not have access to primary care that now they see an avenue. They may register with Patient Connect in the coming days or weeks. But if we're looking at rolling it out, within months, you will have access to primary care virtually. You will stay on the list for Patient Connect even though you are connected virtually through Teladoc until you have a permanent, until you're connected permanently to either a family care team, a family physician or nurse practitioner, at which time you'll come off of Patient Connect. But I would ask that individuals recognize that this is a phased-in approach. Over the coming months, you will be connected. But I do anticipate people will call Paddy Daly or others and say, well, why am I not connected today? But it is a phased-in approach so that the system can deal with the uploading of patients. Steve?
Yeah, one thing that I would add on that is that we've heard from other jurisdictions is the importance of the pathways to in-person care throughout the province, and those pathways may be slightly different depending on the community or the site where the service is offered. So we've our clinical teams internally at Newfoundland and Labrador Health Services are looking at these in-person pathways or follow-up pathways if required, based on the unique needs across the entire province.
Just a detail, I think, Minister Osborne, when we spoke with this in the past, you said that New West's emergency would need to have a nurse practitioner working to aid with the virtual, with Teladoc. Yes. Do they have a nurse practitioner in place in New West Valley?
So it doesn't necessarily have to be a nurse practitioner. It can be an advanced care paramedic or a respiratory therapist, for example. It can be a registered nurse with training in airway management and cardiac. So there are options beyond the nurse practitioner that we'd initially envisioned to ensure that we can keep the doors of either an emergency department or an urgent care center open, but we will need an individual with the background to be able to triage and treat and do the physical examination with the assistance of the virtual physician. New West Valley, we've improved the access in New West Valley to physician coverage. They're not, the emergency department is not on diversion as often as it used to be. But based on need, we're rolling this out to New West Valley first. And like I said, we know what we anticipate to be the second site, but if recruitment means that the third site becomes more pressing than the second by the time we're rolling out, we will announce the second site for virtual emergency coverage in the coming weeks.
And if I could ask one last question. I understand Teladoc's a large company that I think it works out of the US and also has an office in Canada. Is it possible that when people call, they'll be getting virtual care from an American physician?
No, these are Canadian positions, I believe, and I'll get Steve to expand on that, but they have to be registered with the College of Physicians and Surgeons in Newfoundland and Labrador. They have to be licensed in Newfoundland and Labrador. They have to be connected with the NLMA in Newfoundland and Labrador. But my understanding is they will be Canadian positions, Steve?
Yeah, that is correct.
Thank you kindly.